October is Breast Cancer Awareness Month. The Breast Cancer Society has put out an educational video to encourage women to get screened regularly and seek early intervention.
FTV reporter Stephany Yang spoke to the chairman of the Breast Cancer Society, Chen Shou-tung, to find out more about the latest breast cancer treatment and research data.
你的胸部一直都是为了别人而存在吗？现在开始把胸部还给自己，早期筛检才能及早治疗，为自己保留最多幸福。
This is a video created by Taiwan's Breast Cancer Society, which urges women to go for regular screenings and conduct self-checkups. The society says the average age of contracting breast cancer in Taiwan has gradually become lower over the years. On average, Taiwanese patients are contracting breast cancer 10 years sooner than people in Europe and the U.S.
年龄高峰，平均的年龄高峰是在差不多51、52岁。
Our average, the peak age, is 51 or 52 years old in Taiwan. In Europe and the US, it will fall around 60 years old, which is 10 years older than us. The Health Promotion Administration advises people aged 45 and up to go for checkups and get a mammography every 2 years. If you want to be extra careful, you can go to the hospital for a breast screening between the 2 years. If you pair these two together, you can detect cancer at an early stage.
Chen Shou-tung, the chairman of the Taiwan's Breast Cancer Society, encourages women to get screened regularly and seek early intervention. He also urges women who have already been diagnosed with cancer to seek neoadjuvant therapies.
第一个重点就是要固定的筛检。
The first key thing is to go for checkups that can allow doctors to detect breast cancer in the early stages. That means the cancer is smaller, and it's more likely the patient can keep the breasts intact. The second key thing is that once the cancer is diagnosed, you should take action immediately. The third thing is that previously, surgery was the first step of treatment for breast cancer, and then post-operative adjuvant therapy. But some of these adjuvant treatments can be moved to the beginning and become neoadjuvant therapies. There are 5 benefits to moving adjuvant therapy to the beginning. The first is that there may have been no way to preserve the breast originally, but after neoadjuvant therapies, the tumor will shrink, and the shrinkage can allow the breast to be preserved. After neoadjuvant therapies, chemotherapy, or targeted therapy, 40% of people who originally had to remove their breasts can now keep them.
Chen says women can take steps every day to lower the risk of contracting breast cancer. These steps include eating a low-fat and high-fiber diet and exercising.
预防方面最主要是饮食的哈。
In terms of prevention, the most important thing is diet. The diet should be low in fat and high in fiber. It is better to have a high-fat and low-fiber diet. The incidence of breast cancer will increase with a westernized diet. Eating habits are related to the incidence of breast cancer. Continuous and efficient exercise can reduce the incidence of breast cancer. Lastly, avoid the use of female hormones. If you use female hormones, it may increase the incidence of breast cancer by 1.8 times in the long term, which is reported in studies.
The Health Promotion Administration provides free mammography examinations every 2 years for all women aged 45 to 69. Those aged 40 to 44 with a family history of breast cancer can also get a free mammogram. FTV reporter Stephany Yang and Lu Bo-tong in Taipei.